Amidst the rising concerns over spreading H3N2, Mumbai's top pulmonologist, Dr. Jeenam Shah, explains the signs and symptoms to watch out for.
The most common symptoms with all the viruses are the same. Generally, people have runny nose, fever, coughing, some sore throat, myalgias, body being very weak, typical of a very viral infection. And most of the viruses have similar symptoms. Very rarely, as I mentioned, in extremes of population or immunosuppressed patients, they do tend to have a lot of problems when the virus goes and enters inside our respiratory system. So what happens there? The coughing becomes very severe. You have breathlessness. Your oxygen level can go down. You might require to go in a hospital only in very few or very selected population, but otherwise most of the population does end up having a very good response. It can infect the other systems of the body also, but predominantly respiratory system is the most common affected organ. Very rarely, as I mentioned, in extremes of population or immunosuppressed patients do tend to have a lot of problems when the virus goes and enters inside our respiratory system. So what happens there? The coughing becomes very severe. You have breathlessness. Your oxygen level can go down. You might require to go in a hospital only in very few or very selected population, but otherwise most of the population does end up having a very good response.
As more and more people get infected, the question arises, what treatment lies for the same?
Biggest advantage of this H3N2 virus that we have is we have a proven and effective drug which is called as oseltamivir, which are available in multiple brands. What happens is it's a 5-day course. If you take it within the first 48 hours of your symptoms, you have a very good response to that virus, and 5 days you are absolutely okay. Most of the patients don't end up requiring hospitalization if you have taken that drug properly. This is a viral disease. No antibacterial agents is going to help you. Only drug that helps you is oseltamivir. Antibacterials are not indicated, so please don't end up popping any kind of antibacterials that is available very routinely in your vicinity. Apart from that, the treatment is very routine. It's a symptomatic treatment. Say you have cough, you take a cough syrup. If you have fever, you take a paracetamol tablet. If you have a headache, you take such kind of tablets. Those are very simple, routine household management. Apart from that, drink always plenty of water. Hydration becomes very important in any kind of viral disease. And obviously, you need to prevent your close ones by avoiding to get too much in close contact with them and preventing the spread of the disease. Generally, this disease spreads from anywhere between 72 to 3 to 5 days of your illness. So once you have the disease, within 3 to 5 days, you stop having the spread of the virus, and after that, you are pretty safe to venture out and be in contact with people. But till that time, 3 to 5 days, try to avoid being in too much of contact with those vulnerable population. And apart from that, always remember, please wear a mask. Even if you are feeling that you are slightly infected, please wear a mask so that everyone else along you is prevented from the disease.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.